Hello everyone, myself Dr. Harneet. I'm a consultant psychiatrist and psychotherapist based in Punjab, North India. And it's an honor to join you all here today celebrating 30 years of Union of Mental Health. 3 decades that have not merely observed but have actively shaped the global evolution of psychotherapy. I would like to thank the organizing committee and the Vice President of World Federation of Mental Health, Dr. Roy, to invite me to serve as today's flagman, a role that I take very seriously because this is not just a dialogue that I have studied, this is a dialogue that I have lived. And the 3 decades of psychotherapy in India, I'm going to talk about two of those decades, the initial 2 decades. I've read about those in my training, in my residency, studying about the theoretical debates of psychotherapy, the paradigm shifts, and its initial struggles to globalize itself without flatlining the cultural nuance. And the past 1 decade, I have lived it in my clinical psychiatry experience, in my community psychiatry experience, where psychotherapy doesn't exist in abstraction, but it is actually executed on ground level with all the limitations such as class, caste, religion, technology. And here I am today, looking towards the next decade, knowing very well that the next decade demands approaches that are going to be culturally collaborative and culturally adaptive and globally collaborative as well. So, without further delay, I would like to start my presentation. So before discussing the major transformations that have happened in past 3 decades, I would like to discuss briefly about the significant milestones in the history of Indian psychotherapy. So talking about pre-20th century, when psychotherapy wasn't even a formal discipline, India already had Guru Shishya model, which can be translated roughly into mentorship or behavioral guidance, and concepts of yoga, pranayam, which can be roughly translated into mind-body integration and behavioral regulation. 1950s and 1970s, they mark themselves as early Western influence period because many psychiatrists, many mental health professionals trained in UK and USA, and they brought back the Adlerian and Freudian concepts, and also psychodynamic approach that was started as a teaching skill in many institutes all over the nation. 1980s to 1990s, this is the period where the evidence-based psychotherapy started in India because this was a big shift, and behavioral and cognitive therapies, they started increasing, and CBT became a teaching skill, and it started appearing in pockets all over the nation. Clinical psychology, it started coming into the picture in 1990s, and therefore psychotherapy became shared between psychiatrist and clinical psychologist. 2005 to 2015 marked themselves as urban mental health boom period, when workplace stress, it started gaining awareness, and people started talking about mental health issues. 2015 to 2020 was the digital revolution, definitely catalyzed by the COVID era, the COVID period, because digital access improved, and digitalization also made telepsychotherapy somewhere mainstream. And people started shifting their focus from discussion of severe mental illness to more regular issues, more routine issues such as anxiety and personal growth and relationship issues. Current era, we are going to talk about it in the coming slides, but this whole 70-year arc is the journey that the nation has traveled from ancient introspective principle to the more culturally intelligent and integrative psychotherapy. That is how far we have come. The main transformations that are there, that in past 3 decades, mental health has entered public vocabulary in ways that we have not seen before. It is spoken openly now, on screen, in schools, in healthcare sectors, and in workplace sector. We have moved from more generic guidance or counseling approach towards evidence-based psychotherapy practices. Our mental health workforce has also increased, not just in number, but also in diversity, because clinical psychologists, psychiatrists, clinical counselor, and psychiatric social workers, they exist as a collaborative, uh, co-managing ecosystem, which wasn't there 30 years ago. And because we have progressed, shift towards early intervention is also there. The service provision is more prompt because of early identification and early screening. The stress profile of India has also transformed because of the shift from joint families to nuclear isolation, and local pressure to global expectations, slow living to hyper functionality, basically. So, therapy has had to evolve to match this new emotional Indian terrain. And psychotherapy is no longer viewed as as a separate or optional or inferior to medication, because clinical psychologists and psychiatrists, they work as a more collaborative team now. There's more co-management. Definitely this perspective of not seeing psychotherapy as an optional treatment or intervention, that perspective is limited to urban areas for now. It is not that prevalent in rural areas, and even in urban areas it exists in small pockets, so this still has to gain more popularity yet. The major transformation, if I have to pick, is that is digital and teletherapy revolution. Because COVID-19, it normalized teletherapy over the phone. It normalized seeking treatment over the phone overnight. And many people, they started accepting the treatment over the phone. This was India's big bang moment because the access expanded dramatically. Because for the first time, people in small towns, they consulted specialists in metros without traveling. And many people in who didn't have flexible work hours, they started seeking treatment without traveling. So this was India's true digital win, that the therapy became transport free. And there are a lot of multiple online platforms now. Some are government initiated and some are private online platforms. There is a rise of mental health apps as well. There are so many mental health apps. Therapy is available in plus 12 Indian languages now. And definitely every modality has pros as well as cons. We all know the pros of digital psychotherapy, but the cons are also there because there is limited regulation, especially on private online mental health platforms. There is variable training, we can say, and there is a new form of therapy that has emerged, that is 15 to 20 minutes of micro sessions, 15 to 20 minutes of very solution focused and goal driven sessions in which the approach is very directive. So definitely a lot of challenges are there when it comes to Indian psychotherapy, because despite this digital revolution, rural India, is still not getting the piece of cake, and it is still underserved. And poor internet access, poor digital access, this digital divide that there is, and digital illiteracy that is definitely, it is actually perpetuating the treatment gap that is there since so many years. And there, like I said, there are no strict quality standards, there are no strict regulations over the online mental health platforms that are private in India. Talking about what hasn't changed, despite mental illness being a rising public health concern, public health burden, the national investment in it remains symbolic rather than strategic. And when we talk about stigma, it has definitely softened in vocabulary, but not in behavior. And people talk more comfortably about mental health issues, but they still are so hesitant to seek treatment for themselves. And we treat the identified patient, but the familial ecosystem, the family ecosystem, that sabotages the illness or sometimes perpetuates the illness, that seems still remains largely unaddressed. We have progressed so much, we have learned so much, but still, people struggle with the basic vocabulary of emotions, and emotional illiteracy is a huge issue. People walk in the OPD and they still seek relief from their symptoms. They are not looking for insight, they're not looking for reflection, and they are not willing to actually wait for the response to come or the psychotherapy to come into the effect. They want immediate relief. And psychiatric symptoms, they are also seen somewhere as somatic still, because, like I said, that the emotional vocabulary is very bleak. So, a lot of headaches, a lot of stomach aches, and a lot of body aches they present, where the issue is clear cut, some stressor that is existing there for a long, long time. And psychotherapy is the only answer to get that insight. But it reminds us that the body still remains the best place to hide the psychological suffering. And when we talk about research, definitely our research output has not matched our clinical ground reality. So these are the things that hasn't changed in past 3 decades. But the biggest status quo, if I have to pick, and as I like to put it, that psychotherapy is still the caviar of mental health. It is rare, it is expensive, and available only to a few. Why? Because barrier is mainly cultural and economical. There is minimal meaningful insurance. The availability of psychotherapists, that is also a big issue because they are clustered around metros and rural areas. They don't have any psychotherapeutic infrastructure. Time definitely is a privilege because many patients, they seek treatment in government hospitals, and government hospitals are already overwhelmed with the number of patients. So it is very difficult to devote 45 minutes or 1 hour to every patient, that too in a private setting. So a psychotherapist in government setup definitely cannot practice in a very ideal manner. So many patients they seek treatment then in private sector where they are obviously stuck in a vicious loop of time, money, and again much needed healthcare. Even if we talk about West, the systems are very stronger, the stigma is very low, but still therapy is only accessible to those who have flexible hours, who have time to spare, who have insurance coverage. Many minorities, immigrants, and working class families, they still don't get to take the benefit of psychotherapy services available. So different continents and different contexts, but still the bitter truth is same. The mental health is spoken of as universal, but it is experienced as exclusive. And India definitely, as I said, that it is at a crossroad. The progress is there, the gaps are there, but still, it is. We are way far from an ideal picture, and we have to see how, in the coming time, we are going to manage these gaps, how promptly and how smartly we're going to manage these gaps. As I draw to a close, I will leave you with this: that these 3 decades that have changed the way we understand the human mind. Neuroscience has sharpened our precision, integrative models that have broadened our perspective, cultural intelligence has deepened our understanding, and digital access has expanded our reach. But the heart of human therapy remains exclusively, unmistakably human. These 30 years have taught us that science refines our tools, but it is only lived experiences that actually refines our wisdom. The mind sits an intersection of both. It can be studied in a lab, but it can be truly understood only when two people listen to each other in a closed room. The paradox is still with us that our psyche evolves way faster than any theory. And therefore, the golden future of psychotherapy will always remain a pursuit and never a destination. It will always be an evolving dialogue between what we knew, what we do know today, and what we still have to know in the future. Thank you so much for having me here today. Thank you so much.